Hey fam, it's Rafaela. Radiation therapy can be tough, and one of the hardest side effects people face is severe skin reactions. Today, I'm breaking down what these reactions look like, why they happen, and what actually helps, what to avoid, and the mental health side that often gets overlooked. This is for anyone going through treatment or anyone supporting a loved one. Remember, this is for education only, okay? So always follow your care team's instructions first. Okay, y'all, so I have my notes. Let's get to it. So, radiation therapy works by targeting cancer cells, but it also affects the healthy skin in the treatment area. Reactions range from mild redness and dryness all the way up to peeling, painful open skin, or even infections. If you notice spreading redness, pus, bleeding, fever, or severe pain, those are red flags on the play. I think that's correct. That means call your care team right away. So this next section is what helps. The do's. Let's go that way first. All right. So first, wash gently with lukewarm water and mild fragrance-free soap. Pat, don't rub. You're probably going to want to rub, but don't do it. Ease back. All right. Keep the skin moisturized. If it's not intact, meaning if it's not open or weeping, stick with fragrance-free creams or ointments. Some doctors prescribe mild steroid creams like triamcinolone to calm inflammation only on intact skin. Okay, y'all? Never on open areas. So my next bullet point is make sure you ask about protective dressings or silicone film gels, especially if you have open or moist spots. These help cushion, protect, and absorb drainage. Make sure to wear loose clothing, soft clothing. Let the skin breathe because our skin is an organ. Okay, y'all? Make sure to use a handheld fan like my little trusty. I have not named it, but normally I name them, but I didn't. Use a handheld fan or a cool dryer after washing to keep the area dry. So once you're done washing, you just turn your fan on and you dry it like that. I'm sure if you have open wounds, putting air on it close up wouldn't feel nice, but maybe a little further away, you can have someone else do it for you. Or have a fan, like an actual fan on. Okay. Where am I at? And lastly, keep the area out of the sun and avoid heat like saunas, hot tubs, or heating pads. Now, you'll be able to tell whether you can avoid heat or not easily when you're taking a shower or if you take a bath. Okay, you'll know if you'll feel lightheaded. Most of the time people feel lightheaded and when it's hot in the shower. And you feel like you might have to sit down, okay, let's not fall down. Let's test it, but not try it, okay? What not to do. Don't scrub. Don't exfoliate. This is a time where you do not want to exfoliate. You want those layers of skin to build and repair on itself and fall off like if you wash gently and some comes off naturally, That's fine, but we're not putting a lot of pressure on our skin. This is where we got to be treated like a baby, okay? Don't use perfumes. Y'all, I did say that. I did. I'm not going to retract it, okay? Lotions. Don't use perfumes, lotions with alcohol, or harsh toners. Don't peel off the flaking skin, like I said. Don't put creams or ointments right before treatment. If you're going through treatment at the moment, do not put creams on right before treatment unless your care team says it's okay. So that means you need to let your care team know that you have somewhere, wherever the location is, it's, something's happening. It's red, it's flaky, there's some funky stuff happening, okay? Um, they usually want skin clean and dry before radiation. So make sure you what? Contact your care team. Bug them. Bug, bug, bug. So here's a part most people don't really talk about, but it's essential to the process. All right. And it is mental health and your emotional side. All right. So radiation takes a toll not on just the body, but for sure the mind. Because if you're having radiation, more than likely you're having chemo too. Let's just put it out there. They like little skip to the loo friends down the street. Okay. So anxiety, depression, frustration, these are real and common. All right. Up to 1 in 3 cancer patients. I had to reread that because my eyes went like this. Up to 1 in 3 cancer patients struggle with mental health during treatment. Please ask your doctor for referral to a psycho-oncology program, okay? That program I did not know existed. So, of course, y'all know I always put information in so you guys can find these resources local in your area, okay? Or an oncology social worker. You just talk to your nurse, one of your nurses. And if you're struggling or if you feel like you're about to start struggling, because, sometimes you're like, no, I can take this, I can do this, but still get that extra support. You never know when you might need the little tidbits to put in your little toolbox and take along with you so you can assist yourself, okay? So, therapy, support groups, and even just talking it out with someone makes a huge difference. And if you're ever feeling too heavy, remember the crisis line 988 if you're in the US. Okay? I have called this line personally several times. So if that's something that you need, definitely tag it in. All right, y'all. So that's the real deal on radiation skin reactions. What to look for, what to avoid, and how to care for both your skin and your mental health. If you're walking this road, know you are not alone. Drop your tips or questions in the comments because we really do heal better together. All right? Remember to keep going. And even though it may be hard sometimes, remember to love yourself. Why? Because you are an amazing person.